Hey, what's happening, Brooke? Thanks for coming on today.
Thanks for having me.
This is we were just talking. This is the first mental health expert we have come on the show. And most importantly, I didn't highlight that it is the first true medical doctor that we've had come on the show.
I feel so special.
So speaking of that, let's lay the groundwork here. What your credentials are and how you got to where you are.
So I am a sports and performance psychiatrist. I went to medical school, so I completed 4 years of medical school. I did 4 years of adult psychiatry residency, and then I did another year of child and adolescent psychiatry fellowship.
Let's talk about the difference between all the different credentials that come with mental
Okay.
health professionals, because there's psychiatrists, psychologists, there's licensed professional counselors, there's certified performance mental coaches, and then there's just life coaches. So let's break
Right.
it down as far as what everyone is.
Yeah, there's just so many acronyms, it's hard to keep track of. And I guess on the plus side, it's nice that there's so many professionals working in mental health. So I think, I feel really blessed that we have such a collaborative team of clinicians available to work with our athletes. So with a psychiatrist, we're MD or DO medical doctors who can diagnose and treat mental health issues with medication, with brief therapy. And so we're actually prescribing medication. Clinical psychologists are often PhD or PsyDs, and they provide therapy and can diagnose mental health conditions and really can provide really specialized types of therapy. Now, licensed professional counselor, there is LMFT, which is marriage and family therapist. They really focus on counseling services with a focus on mental health and well-being. And then depending on the state law, they can diagnose mental health conditions as well. And then lastly, there's certified mental performance consultants or coaches, CMPCs, and they are credentialed through a certain certification program where they have a certain amount of clinical hours, supervision, mentorship, and they really work with athletes on mental skills training and different aspects of overall mental well-being.
Perfect. That was super helpful and hopefully lays the groundwork for everyone understanding the different credentialing and titles that are out there. How did you get linked into sports psychiatry and also some of the association that you're a part of?
Yeah, so initially, way back when I had started a concierge psychiatry practice, which simply meant that I could go to people's homes, I could see people in the office, they had my cell phone number, and I really provided just all access and comprehensive care around the clock. And I kind of fell into sports because I was finding myself getting a lot of requests around like pro athletes for their children, and they didn't want to be seen in the office setting. They wanted me to go to their home so they weren't recognized. And I kind of fell into sports like that, just kind of accidentally, and then just found that I absolutely loved it. And then we had met in our time with the Suns, and I got involved there and started working with athletes. And so that really kind of propelled my interest and passion for sports, and it just kind of blew up from there.
What was it about sports that was like your interest and attracted you to the space?
I think seeing that from the outside, that athletes look to the general public like they have it all together, right? That they live this glamorous life and it's so amazing and they have all the money and time and, people around them. And then seeing internally from the inside how much struggle there is and how isolating it can be, I think really just made me passionate about wanting to help them because they don't have anyone other than their inner circle. And I'll never forget, I asked someone that's very well known, how do you even make new friends? And he said, I don't. So it's just not even an option for a lot of these guys and women.
The isolation part is something that is unknown or not necessarily spoken about, simply because if you don't experience it, you don't know. So can we double click on that and just maybe pull back the curtain a little bit more? Is like, why do you think the isolation exists in the sports space, not only for athletes, but even staff members too?
Yeah, I think the hectic schedule, right? There's always a place to be. There's always somewhere you're preparing to go. You're in a new city, different time zones, and it almost just feels like you're being shuttled around, dropped off from place to place. And so the little bit of downtime you do have during the season, because we're talking about professional sports here, there's athletes of all levels, but specifically in professional sports, you're just stripped away from a normal routine. And like you said, staff too. So now you're on the road and you can't have a 5 o'clock tennis lesson every Wednesday, right? It just doesn't exist. And there's no sense of stability. And I think that that loss of consistency and that increased isolation really has this kind of spiral effect on people's mental well-being, and then on your side of things too, their overall physical health can suffer as a result.
Great segue into linking the mental into the physical right there, because I think that's probably where our paths have crossed and where we have come to work together with our time in team sports, but then outside as well. So before we jump into the integration of those two, can we talk about again, laying the foundation for terminology? It's mental health, mental wellness, mental illness, and mental performance. Could you elaborate each of those four to kind of delineate what they are, and or if they are similar, different, better, worse yet? I don't know. I'm asking the question because I think it's
Yeah.
important to determine what those terms are.
Right. So I think mental health is purely the absence of mental illness. So mental health is really just an overall psychological well-being, whereas wellness itself or mental wellness is more multidimensional. It includes kind of physical, emotional, social, occupational dimensions. Whereas mental illness then is a state of kind of poor health or dysfunction where there's a actual kind of issue going on. So I think of the stoplight system where like red is like mental illness or true struggle or almost crises. And then yellow is more kind of that stress, and you're starting to get from being in the green zone to the red. And then green is having good mental health and overall well-being.
And then where does the term, like in some sports, I think, baseball popularized it, maybe even golf too, maybe tennis, but mental skills training, where does that fit in as far as terminology and within that framework of red, yellow, green, which by the way, I love.
Yeah, I think mental skills training is just taking mental health to the next level. So someone that's already high functioning or in a high performing environment, whether it be more like C-suite CEO or an athlete, they face very similar struggles but in different environments. And mental skills training is using different kind of skills or a different tool set like visual imagery and mindfulness, meditation, all these different skills to build resilience and confidence and enhance both mental and physical performance. So I think it's almost like taking someone that's in the weight room and they want to like really hit a PR, and you're like, okay, to take you from where you're at to there, like mental skills training on the mental performance side will really take you to that next level.
I love that analogy. So let's go there because I think you have an interesting perspective here in describing this. So if someone, right, you just labeled a, hey, like a PR in the weight room, a PR in return to play, a PR in a physical performance. How can those that are not in a clinical setting using maybe specific outcome measures or scales, how can someone implement some of the mental skills training or be aware of it, but understand where the trajectory is going from a measurable perspective?
Yeah, I think in a team environment, it all starts with education, right? Because even if you have all the tools and skills to do something, whether it be on the physical performance side or the mental performance side, without the group or environment understanding the importance of it and what it can do for its players and overall team, there's like going to be no interest, right? So I think the first key is just providing education, and from there, by educating not only players but staff and management, then you can really move to the next stage of, okay, how can we implement this? And from the mental skill side of things, it's interesting kind of diving into return to play a little bit, that there's been so much research and study recently on the mental side of return to play, because as you know from what you do, there are so many physical benchmarks you have to meet before getting back on a quarter field. And it's like you can't even think about doing that after an injury until all these things are met. And if we're saying that the mental side is just as important as the physical side, why are there not those benchmarks? And so that's part of my interest is in policy development of, okay, we have someone with a acute, like short-term injury, moderate and long-term. What are these objective measures that we can kind of provide objective benchmarks and assess in addition to the subjective clinical interview to ensure that a player is progressing to get back on the quarter field? So I think that there's a lot objectively that can be done.
What do you foresee, or maybe you already have them, those benchmarks being from the mental health space?
Yeah, one is confidence to return to play. So there is different scales like we talked about before in the past with ACL, and there's different scales that assess a player's psychological readiness to return to play. And for that, it really asks, what's your confidence with re-injury, or what's your confidence with your current skill, and really goes through a set of questions. It doesn't take too long, and really getting a objective number in addition just to talking to them.
One phrase you said was psychological readiness, and I've heard that term used before, but I don't clearly understand it. So I imagine there's maybe you have a better definition to explain what psychological readiness is, and more importantly, for someone in my position that's maybe not a mental health expert, but can maybe vet the situation of like, hey, are they psychologically ready? So kind of like a two-part, like what is psychological readiness? And then what are some first steps that we can begin to consider if they are ready or not?
Yeah, so psychological readiness, just like with physical readiness, it's their physical ability to get back and actually perform physically that skill. The psychological readiness is I've seen athletes who are like, okay, I've been told I'm cleared to return to play, but I am so freaking scared that I'm going to bust my knee again or that my ankle's going to give out. And so, right there, that tells me that there's already a level of anxiety before even getting back out there. And that is a risk of re-injury, right? So we talk about physical and mental risk for re-injury, and fear of re-injury is one of the top ones. So I think just even for people on the physical side, like yourself, APs, PTs, just asking, like, hey, how are you feeling? I know I've cleared you physically, but do you feel like you're ready to get back out there? That's like a really good broad opener to even just open that door for them to say like yes or no. Because I think a lot of times we're so used to this being a business, right? It's like, okay, management's asking, is this player ready to go back? And so, like, yes, we're telling them they've met these physical benchmarks. And sometimes just talking to the player gets missed because we're all so busy, right? Trying to just get them back out. We forget to ask, it can be forgotten to just check in with them as a human being in front of you, like, hey, we're saying you're ready to go back. Do you feel ready for this, or do you feel like your knee's gonna give out again?
I appreciate you highlighting the physical. Like we're mostly associated with the physical component, but I think we're getting better as an industry of like recognizing the importance of the mental readiness, the psychological readiness. But I think it's still got a long ways to go in most environments. One thing that I've just like case like a little anecdote here. One thing that I've noticed with some cases in the past is they're clearing the benchmarks on everything physically, and then there's almost always one very specific thing that they're like, "Ah, man, I just don't feel like I'm ready because I can't do this one thing." And it's like, man, I can just do my behind the back pass while I'm running towards the baseline. Or if
Yeah.
I can stop start when I'm on the wing and cut back and give it to the left back. Like it's almost like so specific that you can't measure it. You can't put an objective criteria to it. It's just like this is the one thing that they need to get over the hump for. So I just wanted to highlight that and kind of throw that at you. Like, is there anything that you could unpack from that or help me manage better in the future? Because it's just, it almost always happens. It's just the most random thing. But I know once we do that one thing, they're like, okay, I'm ready.
Yeah, I almost would want to back up and be like, okay, so we've gone over, right, that you can do 98% of what you were doing before, yet it seems like you're really stuck on this one thing. And I hear you on that. So do you feel like you're kind of fearing a little bit getting back out on the quarter field? Or, tell me a little bit about why it seems like you're ambivalent or a little bit nervous about that, because that's not your character. And just kind of opening a dialogue about that, because I wonder if that's sometimes almost like, whether it's conscious or subconscious, a delay tactic of they're internally not feeling ready, or they're fearful or anxious about it. And I wonder if it's easier to just jump and be like, oh well, this is what I need to be able to do, so I'm just not ready to go back in yet.
That is such a good point. And I didn't think of it as an internal tactic, like labeling it as that, because you're right. They're not going to tell me on the line.
Yeah, and it's sad because, I think that just goes to show that people are fearful of vulnerability, like you and I talked briefly at a past conference about the NCAA study where they asked NCAA athletes, I feel comfortable, the statement, I feel comfortable talking to my coach about my mental well-being. And that's been on a downward trend where athletes are less and less comfortable year by year talking about their mental well-being. And so I think oftentimes it just gets slid under the rug and people don't want to talk about it. So they're making up these other excuses as to why they can't return to play, or I'm not sleeping well, or something that seems less stigmatized. And really deep down, I had conversations with these guys that appear, like you said, they're like man, right? They're tall and big and strong. Yet inside, you get them in a room and you start talking about mental health, and they're like totally crumbling. And it's just, it makes you wonder, are they just not given the space and the safety to be able to have those conversations with staff and coaches?
So that is what you just said right there is something that I think has been probably the biggest hurdle for yourself or people in your position where you're trying to only help, you're trying to do good, but the space, the environment, the culture, maybe just not there. I look at where I have worked in the past 5 years, 10 years, and it's drastically different. Even
Mhm.
last 12 months, things have been drastically different across multiple environments and teams that I've talked to. So I really just wanted to bring that to your, open up that space for you, not to piggyback on that term,
Yeah.
but open up the space here to say, how do we create the space or create the environment or the culture so that it becomes a part of the high performance model?
Yeah, I think that some teams are already doing it. I've talked to quite a few, and they all seem to be East Coast, which is interesting, where it is really normal, right? Like, okay, I'm going to go meet with the physical therapist, I'm going to go see my AT, and now I'm going to go talk to the team psychologist. And it's like, whoa, that's really cool. Like, it's just out and about on a screen in the training room that you have an appointment. Yeah, that's becoming normal. But like you said, it takes the right environment, it takes the support, and it truly takes the education where people are really understanding the positive impact it can have, not only on that individual as a person, but the whole team environment. And then just something else to throw in the mix that complicates things even further. Let's talk about trade deadlines, right? That, from a psychological side of things, plays a huge role in physical performance. So, like, as a trade deadline's coming up, when I talk to people, they are internally losing it with the possibility that they're going to get traded. Oh, is that why I'm not getting as much playing time as before? Oh, is, this the reason? And they start to ruminate and really get in their heads about it, which you then know it can impact their physical performance if they are kind of distracted, or they're, I call it like brain bandwidth. We all only have so much bandwidth. So if it's taken up by worries about something, you're going to have a limited bandwidth to actually perform.
Can you shed some more light or insight into how you and your experiences in your career, how the business of sport at a professional amateur level has impacted the ability to perform?
Yeah, I think, it's so multifactorial, right? The business of sports in general is one of instability, right? Like, it's not a matter of if I'm going to get traded or fired, it's when, and I think that's the mentality. And so people can never truly feel settled, or like they're not in chaos unless they consciously make that decision to live in the moment. And I know there's that overused term mindfulness, but truly, to truly achieve mindfulness, you really have to be able to live in that moment and not worry about the future, which I call anticipatory anxiety, like you're anticipating the future, or in the past, just ruminating about things that have no added value in your here and now. I think that just the whole business of sports, no matter what sport and what level, really, again, it tests someone's resilience, and that's, I think, where the mental skills training can come in and be really helpful.
So let's get into some of the X's and O's and kind of get into the weeds on some of the mental skills and training. Let's start off by like how our paths intertwine in a
Mhm.
team setting, both from a rehab case when we're talking about physical and mental. So in an ideal state, how can the physical and mental health integrate within the performance during return to play?
Yeah, I think it really, really takes a collaborative, multidisciplinary team to provide comprehensive care to an athlete. So what I mean by that is AT, sports psychiatry, psychology, sports medicine, orthopedic, everyone ideally should be in a team discussion about this, because in the hospital, when we're in training in medical school, there is multidisciplinary meetings where we all go in a room, we all sit down, and we round table talking about each patient. And so I wish in an athletic environment, I know that health and performance staff, that's what they do, that they do a great job in multidisciplinary team. But oftentimes, because the medical staff is not there all the time, that gets missed, and then it's kind of patchwork together. So I think during return to play, in an ideal world, that there would be this like collaborative multidisciplinary meeting with all parties involved talking on athletes return to play, both from a mental and physical standpoint, and then gradually reintegrating them in competition with objective and subjective measures along the way.
What I want to learn a little bit more about here is how to get folks like you, and you particularly, involved early, because I look at it from, player goes down, there's an injury. The first phase of it is we're trying to restore homeostasis, right? Get out of
Mhm.
pain, move without pain, try and manage some swelling if there's swelling, right? And then from there, we're trying to restore function. Then we're trying to return to training, return to
Mhm.
performance, return to sport. Have you given thought, or do you have a working model as far as like the different phases of, let's say, an injury, how you can be involved, or how you can assist the process, or be a big player in the process too? Because I think maybe at the front end and the back end, maybe your work needs to be more weighted than something else. I don't know. I think it's an interesting place to explore, to how we can leverage your skill set in those situations.
Yeah, so I think it's two-part, right? There's proactive and reactive care, both on the physical and mental side. So I think just proactively, whether it's at the beginning of a season or whatever, just like there's physical health checkpoints, there should be a mental health checkpoint where it's just an introduction. So it's like, you get to know the person, you feel comfortable with them, and that's the proactive stage. So then when an injury does happen during season, it doesn't feel like something new is being thrown at you when there's already all this instability and uncertainty. You already know the person, it's normalized, and it becomes a part, like you said, of the physical rehab process. So the model I like to use is having, just like when an athlete gets injured, they meet with the medical staff, they meet with PT, athletic trainer, and really come up with a comprehensive plan to get them back to return to play physically. That at that time, there should also be a check-in with the mental health clinician, whether it's a psychiatrist, psychologist, therapist, mental skills training, whoever is there, just to have an initial check-in. Because if you all of a sudden meet with an athlete right before they return to play, you have no baseline to see where they were at the time of the injury. So what are you monitoring or assessing if, all you might have is the check-in from the beginning of the season? So yes, there definitely needs to be a protocol in place that's very normalized, so it doesn't feel like such a reactive. I think sometimes, especially on the women's side, for some reason, it can be perceived as a punishment, like, oh, I got injured and like now something's wrong and I have to meet with this person. But they don't think that about the PT or physical side. So I think we still have a bit of ways to go with the mental health side.
How do you get ahead of, or reduce, or ultimately eliminate that stigmatism?
I think familiarity and integration is key. Like I had seen someone for just informally out and about around for 2 years before they looked me in the eye and said, now I think I can talk to you. I think that the familiarity is essential because, like we talked about, athletes, especially at a professional elite level, their inner circle is so small that if you're not in that circle, you're just not even an option for them to feel comfortable talking to. So I think integration, being around, being on the road, all those things just help so that when there is a situation that requires a reaction or reactivity, that they already feel comfortable talking to you.
You mentioned the word integration a few times, and earlier you mentioned collaboration, right? How I think those are great words that a lot of us recognize and know are important, but I don't think we're all that intentional about how we integrate and how we collaborate. You mentioned the collaboration component of, hey, like it'd be nice to have a round table as far as having a discussion, learning about what each other can do and what levers to pull on. But I think the integration component is a little bit more important because it needs to be embedded with the philosophy and the model. So I want to just get your perspective on how to optimize the integration for mental health in a high performance space.
Yeah, I think really it goes back to starting with education, right? Because the people that know that it would be beneficial the most might not be the decision makers. And so you really have to spend time educating the decision makers on why it's important, why it benefits. Because again, to them, it's a business. So why does it benefit the athlete, but also how does it benefit the entire team environment to have that integration? And I think that the education piece is just essential because the door is either going to be open for integration or closed, and it's much easier to work through an open door for integration.
I can appreciate that. Oh, I want to share this perspective with you because I've lived this in the past, and it was this idea that athletes don't want to talk to the psychiatrists or the psychologists that are part of the team. Right? There's this fear of, man, they're gonna go rat me out to a coach. GM's gonna call him or her and ask for all the dirt. Like, could you speak upon that very real situation that I've lived? And at times I've tried to push people in the direction of someone like yourself and your skill set, but am met with like, nah, man, I don't want to talk to that person, but they may go seek it outside of the team. And for no, again, I think that
Mhm.
however they find it, that's great. But that very
Right.
real issue that may happen of, hey, because they're associated with the team, I got to be careful with what I say. What's your
Hmm.
perspective there?
It's so real. What you're saying is it happens all the time, right? There's this assumption, right, that what they say is not private or that it's going to be reported. And I think that's where that education piece comes in again. I could lose my medical license if I reveal who I'm seeing or what's going on with a certain person. I could actually lose my medical license for that. And I think just providing that education on what the services are, how they can be delivered, because someone else might just think that because you're integrated, going back to that word integration, they see you around, that you have to be seen there, right? And I think just educating that you could be seen outside, you could of a team environment, you could be seen individually and no one would know about it. I think that's important. And I just think that again, that familiarity of someone seeing and learning about you and who you are, which that is a whole other conversation of just what we're taught in medical school or in training of like being ethical and not revealing anything about ourselves and just talking about our patient. I think that's why sports training is so essential because in these environments, people want to know who you are in order to feel comfortable to trust you with their information. So I think it's a really fine balance of being able to be open and honest, yet holding that professional boundary.
Thank you for highlighting that because it's like you said, it is a real situation that happened. I've had that conversation with colleagues in the past, and so like to wrap this thought up, like for either someone that's a physical therapist, athletic trainer, strength coach, even a sports skill coach, right, that is working in a team environment or is part of athlete care, like how can they take a step forward to better integrate the things that we've already talked about today to help leverage the mental health and performance within either overall performance or rehabilitation situations?
Yeah, I think just opening up conversation, not making it so, not that people do this, but as long as it's not so clinical and an athlete truly feels like you're getting to know about them, their family, what their struggles are, even just asking a good door opener from physical to mental health is sleep, asking how they're sleeping, oh, you look really tired for the last few days. Like, what's keeping you up at night? Just even something like that, I think is a really good gradual opener, making athletes feel comfortable to be more vulnerable. And I think that's a big word is vulnerability, because to a lot of men and women in both kind of gender sports, they feel like going beneath the surface level of their physical performance is making them feel vulnerable. I think that is a barrier that everyone, whether you're on the physical or mental side, has to break through.
How would you define vulnerability?
I think the best way I can describe it is almost that feeling of exposure, whether it's like physical or emotional exposure. It's like, oh my gosh, like I was open with this person. They can see more parts of me, and it's almost like peeling back the layers of an onion. So I feel like vulnerability is feeling that discomfort from some level of exposure.
And then how do you balance the idea of being vulnerable to build a genuine connection versus oversharing, right? Because I've heard the dichotomy of those two, right? Like,
Yeah.
I don't want to know your whole, I don't want you to air out all your dirty laundry, but I care about you. I want to know what's bothering you. So, like, where's the balance there of oversharing versus vulnerability?
Well, I think it's tough because if someone's oversharing, I'd rather someone overshare than undershare, so I never want to make someone feel like they shouldn't have just it, even if it's an entire, I call it an information dump, we've all had those conversations where you talk to someone and they talk for 30 minutes and you got 0 words in, but maybe that's what they needed. So I think that there's never too much oversharing if it's one way, right? I think that the harm or the ethical boundary is oversharing on the other end, where like the professional in a team environment is sharing about themselves to an athlete too much to the point where it makes the athlete feel like they can't even talk about what's going on in their own life. But I'd promote information dumping all the time if they want to tell me what's going on and that's what they needed in that moment, then so be it. I'm there for
I love that. Well, I will keep you on speed dial when I need those
it.
moments.
Yes,
At the
I'm
discount,
around.
we love to talk about high performance and we love to share our experiences, right? You come from a background of not only medically trained, but sports trained, come at a very high level what you do. And you've also worked with a lot of great people. And so this idea
Mhm,
of high performance in everyday life, right? Because it doesn't just exist in sports. Like it's most on display in sports
mhm.
because you get that reward of win, loss, medal, non-medal, right? But in a world of high performance, people are always looking to achieve greater things. So for someone that's trying to make a change to upgrade their lifestyle, improve their performance, achieve high performance in whatever they're doing, what advice do you have for them?
Yeah, I think there's 2 types of people I usually see. One is, like, the one that's got the vision, but they've missed all the logistical steps on how to get there, so they're like, "I know I wanna create this, but oh my god, I didn't even think about these small logistical steps I need to take." And then there's someone on the other end of that spectrum who gets really stuck in the weeds so much that they can't make progress, and they don't see they, like, kind of know what they're working towards, but they just get paralyzed in the minutia of those logistical steps. And so I really assess the person, like which of those do you fall in? Are you A or B? And then based on that, making a kind of like a task list for the person that falls more under A. Okay, you know what you want to do and that you want to be a high performer and get to this end goal, whether it be in business or whatever that high performance environment is. But what can you actually do to get there? Versus the person B, it's like, okay, well, let's stop with all the lists and let's just look at what are you working towards and then build from there. So I think it depends on the personality, and that's what I love so much about psychiatry is everyone's different, and it's not like, and I can say this because my husband's internal medicine, where you have a bacterial illness and it's like, here's the antibiotic you take and get better. But mental health is so different where every person has such a different background and personality traits. So I just love the kind of gray areas that come with that.
As you were describing those, I was trying to think which one am I? And I'm thinking like I'm looking to my left and I have the visionary side of like my whiteboard that covers my entire
Uh-huh.
walls. Like, okay, here's all the ideas. And then it's like, wait, I know I have this laundry list of items I have to do to be able to
Yeah.
get there. So I'm like, which one is it? So
Which
that's
one?
I know it's like which one? Flip a coin. It depends on the day, right? Depends on the day.
Right.
No, I appreciate that because it really does highlight. Do you know where you're going, or do you know how to get there? It's like I think
Right.
it's one of two things, right? And then probably most people could probably bias themselves towards one of that, even though it is a binary scale. Let's for lack of better
Mhm.
terms, I can't appreciate how everybody's different. It's not black and white. It is gray.
Yeah. Right.
Um, the last question I love to ask people, especially someone in your space that has your breadth of knowledge and experience, right? This concept of we're always trying to get the next big thing, but we
Mhm.
often oversee the little things that got us there, right? Finding our small wins, right? So for you, how do you define what a small win is?
Yeah, I am kind of a productivity fiend, so I love thinking about productivity. So to me, a small win in my current day and age right now is just making it through some tasks that you had set out for the day, right? That a lot of people will end their day feeling unproductive, like, oh man, I didn't get things accomplished. But I really try and slow my patients down. Like, think about 3 things you did get done today, and make 3 things you want to get done tomorrow so that you can find those small wins and feel accomplished and end the day with that sense of accomplishment rather than I have this to-do list of 50 things. I only did 3 of them, so I'm a failure. And that's what I hear people say often. And I'm like, no, you're not. You just need to find those small wins.
I am certainly on the side of a list of things to do that almost never gets accomplished. And you get
Yeah.
to bed and you're like, oh, I didn't get to half the things I wanted to
Yeah.
today. But to your
But you
point,
did so much that day, right? I'm sure you could pick out 3 things that you did do that you're like, "Okay, I guess I did accomplish something."
you know what? You're right. It usually is. I can find a few things that
Right.
gets us there. So hey, Brooke, this was fun to actually finally get you on here because it's just been great to ask some more deeper questions, and it's been fun to bring someone of your expertise and knowledge to the audience. So we could keep on going here, but I want to hit pause and give you an opportunity for people to connect with you. So where is it that people can find out more about you, the work that you're doing, or even if they need to employ your services, how they can get in touch with you?
Yeah, through my website, Brook Choulet MD. I do actually list my cell phone number and my personal email address on there so people can contact me, and on Instagram at Brook Choulet MD. So contact me however you need to.
Love it. So we'll make sure we put the contact info both on the web post and here in the show notes. So Brooke, thanks for coming on today, and I appreciate everything that you had to share with us today. It was awesome.
Thank you. This was great. Thanks for having me.